I was in a motorcycle accident, went to a physical therapist a few times a week. Not one time leaving his office did he ever ask me how I felt. Remember to ask yourself, what's the efficacy of the treatment? How effective is the treatment? Is it working? So what type of practitioner are you looking for? Is choosing someone who will tell you what they know, or choosing someone who will listen to what you do?
Which one do you think is going to help more? And which one have you tried that's gotten you nowhere so far? It's not about let's look for qualifications. Let's look at what we're actually trying to figure out. Is this person going to advocate my health? Or is this person here to stand on a podium and say, this is what I know, and I want to teach as many people what I know possible?
Do they want to fit you into the same box as everybody else and give you the same protocol that might help for one person and maybe not another person that has the exact same prognosis because they don't understand it? And again, we're all about awareness and perception and really answering the question we've asked.
Podium Syndrome, I think before we get into it, let's even talk about what the heck that even means. Go back to any graduation ceremony, go back to any formal higher education lecture. Take a look at the fact that what is the person speaking from? He's speaking from a podium, usually at a higher level than everybody else, which kind of takes the dialogue out of it. It makes it more of a monologue conversation.
And it's perfect for the perspective of learning, but it's not exactly perfect for the example of advocation. So when it comes to what we're discussing, especially when it comes to your body, you're the expert and everybody else is advocating for you.
Yeah, so think back traditionally to every single doctor's appointment that you've been on, or any appointment with a massage therapist, or maybe even physical therapist, and go back to, was it a true dialogue? Or was it kind of a monologue, right? Where you went to the appointment and they kind of talked to you about everything that they know, and you probably learned a little bit more, but you didn't feel good. You didn't really feel like it was the right step towards it.
Another example of what Vinny was talking about is, think about a physical therapy office. Generally you go and you're through the mill, 15 minutes on the bike, and everybody has a relatively the same protocol. It's not that stuff doesn't work for some cases, but it doesn't work for all cases, and no one would really listen to your story. We believe that the story has to come out so that you can help to advocate with that person to get you moving forward. So we're going to give you a couple of examples, real world, of that. Firsthand, you would think that going to physical therapy, the advocate would want to know how well what they were doing was working.
Me personally, I was on the phone with a coach from a well-established university who was the head of their program.
Hey, Phil, I don't think that's a very good attitude. You can't talk about hurting other players.
You don't think? You don't think? I don't think you should be butting in when I'm talking to my team.
You know, talking to this guy about one of his star athletes who had a massive injury, not due to any impact, but due to maybe some of their training modalities that they're doing. I recommended that the coach maybe look at things with a different perspective with this one-star athlete. And really, the conversation turned sour pretty quick because it wasn't a let's come together, head of a university, head of posture movement, let's find the middle ground here and actually help this athlete. It was more so, I went to school for this, I've got a master's in this, and you need to provide some serious qualifications before I actually take in what you're saying.
And along the same lines, speaking with a physical therapist from the traditional modality, basically discussing a client that we were both trying to help, and she asked me to tell him about the holistic approach in terms of working with her, pelvis and her hips, and getting a foundation to clear up some of the things that she had going on in her upper body. Now, we're talking very systematically. Prognosis was a labrum tear, and he believes that it has to do with, some of the muscles in her chest and more to do with underneath the rotator cuff and the actual joint itself. And him and I are on the same perspective of looking at other things, but not necessarily listening to my information, which is very hard between practitioners, because again, if we're advocating for our people, then what we're really looking at is hearing in it a piece of information from another advocate and then taking whatever information that he gets, or that we get. Now, the information that he was giving me, I took. It was very local in terms of the actual rotator cuff and the brachial plexus and those kind of things. And she's been through that. And here's where, again, my mind as an aware and perceptive person starts to ask more questions. Why would we do the same thing that everybody else has done? If we really want to help, wouldn't we start to ask some different types of questions? Wouldn't we reach out to some different perspectives? That's the real perspective change. The change in perspective, looking at something differently, not the same as everybody else has looked at it.
Same conversation with the coach. Being a battle of two ideas and not finding a common ground, not listening on his end to that there might be something observably going on. It's not about him being right, it's not about him being wrong, it's not about the education, it's let's look at this star athlete right in front of us and let's just observe for a second. Is she in pain? Does she hurt? And is what she doing potentially contributing to it?
And if you're a practitioner, we're not telling you you're wrong for knowing or being the best at what you know. We are telling you that you're not doing the best by your clients if you're not listening to their perspectives, and if you're not advocating for them what's going on with them. They're healing themselves, you're advocating.
This is everybody's unique story, and we have an opportunity as practitioners to listen to it and really kind of give them their own twist of it and try and help them, or we have the opportunity to tell our story of our knowledge again and again and again. Going back to what I said, which was we're made to connect, we're made to tell our story, we're made to share our experiences with others. Why should medicine, why should pain relief, why should any of that be any different?
Vinny, it shouldn't be any different, because when you are working on your health or your wellness, it's you working on it. Tons of practitioners, modality experts have a ton of information because they spent time looking at YouTube videos like this, with their noses in books and finding out what the practices, the protocols, and all the experiences of other people are. But let's take a step away and make sure that we're still in the practice of experiencing and not just protocol.
So I want you to go into your next appointment with a question I want you to ask yourself. Whether it be a free session at your local gym with a trainer, whether it be your first physical therapy appointment, or maybe you got injured and your doctor's counter just opened up. I want you to walk into that appointment and give yourself some time to figure out, is this somebody that I'm looking up towards in terms of they're on a podium and they're here to tell us what they know? Or is this somebody who's going to get away from the podium, walk down the stairs and sit right next to me and ask me how I'm doing?
And if they do ask how you're doing, are they going to qualify it if it's not well? And then are they going to sit beside you and allow you to qualify it, or they're going to ask you to change the perspective? Or they're going to ask you to change the perspective in your mind and look in another direction. And they'll look with you. Or you may have to tell them, I think that we need to look in this direction. Countless time after time, and how we do our process is asking lots of questions from our clients, from our people, from our tribesmen, to find out what they think about what's going on with them. Because they live in their bodies and they understand more so than what we do via experience what's going on. You don't need to choose an expert based on expertise. You need to choose an expert that speaks the same language as you. Imagine going to another country and trying to explain to them how your day was yesterday. They're not going to understand, they're not going to know. If you're speaking the same language as your practitioner, they're going to understand, they're going to know, and that doesn't necessarily mean that's the expert in the building. Now, sometimes you need the expert. How do you know? You have to look at it a little bit differently. When the person asks you questions, are you qualifying as well? That may make it very difficult to not qualify, and you might need to choose somebody different.